There are a variety of roles that we play. Okay, so the enabler, okay, so the system's perspective, that is how we work. The system's perspective suggests that everything is related to each other. Okay, so the concept of wholeness means that the objects or elements within the system produce an entity greater. So the systems theory suggests that we're all interrelated. So if someone in the family, if they're over here and they lose their job, right, the kid's acting out. What a surprise. We're all interrelated. So that's the goal of understanding the importance of wholeness. The concept of relationship. So the concept of relationship asserts the pattern and structure of the elements in a system are as important as the elements itself. So while the whole family is extremely important, the mom and the dad are just as important relationships. This talks about Masters and Johnson. Those are our sex people. If you don't remember, back in the 60s, Master and Johnson, they were one of the first people that actually came out. And they actually looked at people having sex live. They had volunteers, and they put you in this room, and they hook you up to these machines to check your respiration rate and your pulse. So Master and Johnson, when their theory first came out, it was, oh my gosh, this was the 70s, and we talked about sex. So you'll see some of their research.
Do you want to listen to this on?
Okay, so systems theory, again, looks at the whole person. So with Masters and Johnson, they found that sexual dysfunction primarily occurred between the nature of the relationship rather than the psychological makeup. So it wasn't the thing wrong with the person in a marriage or a relationship. If sex is the problem, it wasn't the head of either people. It was the importance of the relationship with two people. And I think that most of us can agree with that I need that fun outside the bed, that stimulation outside the bed before I can have it inside the bed. System theory opposes simple cause and effect. So a cause and effect therapy says this happened, then this happened. But systems theory says everything is entangled, and that's how it works. Okay. So when you look at these roles, you're looking at the roles that you want to play. And I didn't go over those. Let me go back over those again. Okay, so an enabler. An enabler is a good thing in social work. We always think an enabler is a bad thing because enablers, we think of the drug and alcohol users, right? Enablers allow you to get those to do those things. So the broker, you're actually making changes. Advocate, you're advocating for your client. Empowering, we empower people to make their own life choices. An activist is a fighter. We're going to fight for a shift in power. It's not fair that because I don't have a lot of money that my kids get the worst school. That's not fair, right? We believe in social justice, that it really should be fair for everybody. The mediator, many times that's in a divorce setting, right? You're kind of settling disputes between two people. A negotiator is a little bit different because the negotiator, the people that are already in conflict, usually somebody has to give up something. Unlike a mediator who has a neutral position, a negotiator is aligned with one side or the other. Okay? So again, educator, we're always teaching, initiating, coordinator, research. Little public speaking. One of the things that before COVID, I always made my students take the public speaking class, because at some point in your life, you're going to be public speaking, whether it's in a classroom or a courtroom in front of a group of people, you're going to be public speaking. You are the hero. So as you're going through school, you may not feel like the hero. You may think, oh my gosh, I'll never learn this. I'll never get it done. I'll always feel like I'm inferior. But your clients don't know that. You could be day one. And I worked as a bartender all through school. And So I remember like attending bar one night, and then I graduated and started a job the next day. And suddenly I'm like, what? That people look at me? And I remember being at a meeting and someone said, oh, you look familiar. And I said, yeah, I used to be a bartender. And my supervisor said, don't tell people that. Because you want to come across as you know exactly what you're doing, right? You want to come across, so you fake it till you make it. So public speaking, social workers occasionally talk to a variety of schools. They talk to public schools, public organizations, other people. Sometimes we're informing people. For example, Family Preservation Service. So family preservation is what we believe. We believe that biological children belong with biological families if at all possible. We all know that's not always possible, but truly that's what we believe. So I may be speaking in front of the judge in the courtroom on my thoughts of whether or not this kid should be returned or not. And you're thinking, oh my gosh, I'm terrified, I'll never do that. You will. I promise you, you will, you will, you will. The goal of school, and especially as you start your internship, is to go from that non-professional belief over to being a professional. Right? So if you started your internship yet, you've noticed that you know, the way we talk and the way we act, we've got this very professional look about us. And that's the goal of school, is to take you from being a person who wants to help to a person who has been trained to help. Okay? And you'll gain all of these skills. It really is a matter of just learning. Okay? A couple of models that we take. So the medical model looks at people having a mental illness the same way as you would have any other problem. So in 1920 to 1960, we began to looking at assessing and trying to change human behavior. It was originally initiated by Sigmund Freud. So everybody knows that Freud was crazy. He had sex. He talked about sex all the time. His developmental stages in life were oral, anal, phallic, latency, and genital. He believed in that phallic stage from 3 to 5, where a boy was in love with his mother and the little girl was in love with her father. So while Freud does have a lot of crazy stuff about him, one of the things is he really brought talk therapy into the class, into the world. Before, we really saw mental illness as being possessed by the demons, and maybe even having someone come out and exorcise the demon outside of you. So what he says, hey, wait a minute, let's treat this like a medical problem. So it is, schizophrenia, diabetes, right? Depression, heart disease. We treat them all the same way. It's taken a lot of time, and you'll see this happen in the 60s. So it's taken a lot of time, many times, for other professions or people in general to see that, but really that is how we treat it. So whether you're going to your therapist or your doctor, either way, the symptoms should be treated the same. So in regards to emotional and behavior problems, the medical model conceptualizes people with emotional or behavior problems that are given medical labels, schizophrenia, paranoia, all those things. That's part of the medical approach. There's really just something wrong, okay? We do know that when it comes to mental illness, there's definitely a genetic piece, the same genetic piece that we would have if our parents had heart disease or diabetes, right? So just because my father had heart disease doesn't mean I'll automatically get it. It does mean, though, that I would have higher risk of getting it because of that genetic piece. And if we look at things like drugs and alcohol, we do know there is it's 75%. So 3 out of 4 boys will definitely develop some sort of addiction, whether they're raised by that biological father or not. And that is, again, that's that medical piece, that genetic piece of how I was born. So, major medical diagnosis according to the APA, which is the American Psychiatric Association. Neurodevelopmental disorders. Neurodevelopmental means it happened when I was in utero or as I was born. So neuro always means a brain. Okay, and neurodevelopmental are things that happen many times, again, either at birth or even in utero. So if we look at things like ASD, the autism spectrum disorder, ADHD, Tourette's. Tourette's is a disorder where people actually, they sometimes will say bad words, right? It's an anxiety disorder, and they have tics. Sometimes they're facial tics, and sometimes there are other movements in their body, and sometimes controlling what they say. Schizophrenia, that's a spectrum. So in order to have schizophrenia, you have to have both hallucinations. Hallucinations are things that I see, right? And then I have to have delusions. Delusions are my thoughts. So when it comes to hallucinations, you can actually hallucinate with all 5 of your senses, which I think is pretty cool because people always think you hear and see things. So you'll see those 5 common types of hallucinations, right? Visual is we hear and see things that other people don't hear and see. And you've probably seen some movies where people are walking down the street and they see like an angel or a devil or something coming after them, and they're freaking out and no one else sees it but them. Olfactory is your sense of smell. So your sense of smell is you smell it everywhere. A common one is I smell my skin rotting. I smell like death. And I smell it everywhere. I smell it at home, at school, at work. And there's no convincing that person that that is not happening. My gustatory hallucinations, okay? So that is a matter of what gustatory are taste. Wait, let me back up. Olfactory are the smell. Gustatory is your sense of taste. Gustatory says, I can taste the poison in my mouth, right? I can taste the poison in my mouth. Oh my gosh, I can taste it. And then auditory, of course, hearing things. And tactiles are bugs or things. You've probably seen one of those CSI movies, or one of those movies where the guy swears he has like the aliens have implanted something underneath his skin and he can feel it. And there's really nothing there, but tactile is anything on your skin that you might feel. Okay? Then those are all of them. So all 5 of my senses can hallucinate. The difference between hallucinations or inside of my head, delusions are my thoughts. Okay? Show you this. So if you ever decide that you want to see what it's like to go back and to see what it's like to be having an hallucination, there's some really cool videos out there on YouTube. So this is what it looks like, and I'm not going to play the whole video, but if you ever want to go back and look at it, so it kind of talks to you, it helps you see what it's actually like to be having hallucinations or psychotic. So the goal is to kind of see what it feels like. And we used to have face-to-face class. I would tell you to watch this video, right, with your headphones. So that's what you see, and then try to go around and live a normal life and try to talk to people and see what you're doing with these voices that are always protruding in your head. Okay, so I'm just going to give you just a few minutes of it. Again, if you want to go back and watch it, you can. But it's pretty cool of just seeing what it's like to have those hallucinations. That looks like I'm not getting sound. But again, it's kind of their voices in his head talking to him. So you might want to just check that out. It's pretty cool. And I just Googled or YouTubed hallucinations. So going back to our lesson, let me go back to where we were. Okay. Bipolar 1, bipolar, that's a matter of those ups and downs. We used to call it like a, gosh, I don't know what we used to call it, but it's a manic episode, right? So my bipolar people, they'll go for 5 or 6 days and not need sleep. They're off the wall, kind of making really poor choices, and then they'll crash for 5 or 6 days. And of course, major depressive disorders. So the medical model suggests that, for example, in some studies, identical twins have a 50% chance of, if one of them has it, the other one will have it. So we do know that there is a medical problem behind that, okay? Keep in mind that the rate of schizophrenia in the United States is only about 1%. So while one identical twin is schizophrenic, the other one has a 50 times more than average, when we only have about 1% in the United States. One of the things about schizophrenic in general is it's probably one of the saddest disorders that I think. So with schizophrenia, most happens usually between the ages of 16 and 25. And what happens is we've got this person who is somewhat normal, and many times they go away to college, they go away to, they get married, and we think that middle stress many times triggers some stuff that might have been there already. So then they go to a full-blown psychotic breakdown. So a mom will get a call that their kid is dancing naked in the fountain at school, or they're acting really, really bizarre. So that's a kind of scary thing, because you've had this regular person, and then suddenly you've seen them develop full-blown schizophrenia. Okay. The ecological model suggests that there is something about the environment, okay? So maybe it's growing up in this area, maybe it's growing up in poverty, maybe it is what you saw happen, right? So your ecological system is your environment. So one of the things that we talk about is when we're looking at a person, we're going to look at them in their environment. So behavior that may be normal in our environment may be abnormal in someone else's environment. So especially if we're working with people of different cultures, different backgrounds, and for many times our Asian population, they're not known to make eye contact. So if you're working with a family and they're of Asian descent, and maybe they're keeping their head down. So we're thinking, oh my gosh, they're being disrespectful, they're not listening to us, but I have to understand their environment, where they've come from, how they've seen life. So when you look at a person, you're looking at all those areas and thinking about your own life. So you're looking at your family, your social services, and that doesn't mean necessarily food stamps or anything, but anything you get. So school is a social service that is still funded by the government. So a political system, that's where your beliefs are. Your employment system, your religious system, goods and services, and the educational system. If we look now at the social service system, we have to look at the bigger picture and look at the impact that COVID has had on people's lives. So that whole thing looks at a person in their environment. That's the ecological approach, that it suggests that sometimes mental illness may be caused or may be exacerbated by what's happening in your area. An ecological model focuses on the maladaptive interpersonal relationships in needs and families. So the word INTR, inter, always means more than one person. Remember, intercourse takes two people. If you see the word INTRA, intra, that just means one. Okay, and that's just really good to increase your vocabulary as you're going through college. So interpersonal or intrapersonal. So this is, again, with families. The difficulties cover array between conflicts, power struggles, double binds, distortions, scapegoating, discrimination, all of those things. The term scapegoating means that they blame everything on one person. You know what, if Johnny hadn't done this, then we would have done this. Or if we hadn't done this, this hadn't happened. So scapegoating is when usually a big system, a group, a family blames that one person for all of their problems, which definitely isn't true. Okay, so the difference is we usually look at both. We look at the combination of the medical model and the ecological model. So for example, even if I am predisposed to have depression, if I live in a family that really talks, that's open about depression, open about mental illness, and we discuss it, the odds of me suffering in silence or the odds of me committing suicide go down because this is part of our environment and we talk about it. If I go into a family, if I'm raised in a family that I've got depression and we don't recognize mental illness and I'm not allowed to talk about it, and every time I say I'm depressed and my dad says, oh boy, go in there and shut up, or we don't believe in that stuff, then that really chips my hand, right? If I don't have anyone to talk about it with, then odds are more likely of me really ending up having a major depressive cycle or maybe even suicide. So looking especially in the group practice. Okay, so the goal of group practice, there are a couple of goals, right? We want to enhance the client's problem-solving, coping, and developmental capacities. I'll say that again, and I'll keep saying it over and over again. It's to help the client solve their own problems. We don't have a magic wand. We don't have anything that I can fix it for you. So even if a client comes in and you're working at Child Protective Services and you're giving them food, a bag, right, a food from like your pantry, like a box of food. So I can help them this month, but I've got to problem solve with them so they can come up with how they're going to do this next month. Does that mean they need to apply for food stamps? Does that mean they need to learn to make the food stamps go further, right? So the goal is teaching them how to solve these problems and how to cope all by themselves. I'm never going to be in a client's life forever. The goal is to get them through this crisis, whether it's I lost my house, and certainly if we look at what happened with Hurricane Ida, there are lots of social workers down there now doing some grief work. So just kind of helping people come to the terms of what happened. So that's definitely what's going on, but you won't be there forever. The goal is not for you to be there, and crisis doesn't last always. At some point we adjust. So the goal is to give them those skills. Link them with the system that provides services. So again, if I'm looking at, if I've been working with the Hurricane Ida, and I'm down there in New Orleans helping out, we're hooking them up with the Red Cross, right? Making sure they call their insurance company. Do you need a place to sleep tonight? Some of those basic things. Promote the effectiveness and humane operations of systems, okay? So in our political system, in our legislative, in our legal system, we want social justice. It should be the same for everybody. So when you look at Ida, what you'll probably see on the news, if you notice, is you'll see a lot of the people that are stuck there are people that didn't evacuate. And what we learned from Katrina is it wasn't all the time that people didn't want to evacuate. There's some people that just couldn't. So if we look at people who are poor, right, in lower socioeconomic status, many times I don't have a car that will take me that far. I don't have enough money to put gas in my car that will take me that far. So as you watch the news the next couple of days, what you'll most often see are people of lower socioeconomic status. People who had money, people who could afford it, locked up their house, they drove their car, they went to stay with family or friends, stay in a hotel, and they're fine, right? And if they lost property, they've got really good insurance, and they'll go back and they'll rebuild. The problem is the inequity. In our system, that's not fair. And I'm certainly not suggesting that always we should make sure that I'm not suggesting we always take care of people that are less fortunate. I'm saying that we need to look at evening out the services. If there's a hurricane coming, surely there are services to provide for people who want to leave but can't, right? So we see on the news sometimes and we think, oh, well, they just didn't want to leave, and maybe that's not true. And there's some people who did not want to leave. I understand that as well, okay? So then, when I'm doing that, I can take that role of a program director, a supervisor, a coordinator, or consultant, any of those things to advocate for people that these systems be more fair. And develop and improve a social policy. So social policy are the rules, right? Social policy is who gets food stamps. Social policy is with COVID and what's going on, whether you're not to wear a mask or not. So we're supposed to improve social policy. And I'll remind you, if we go back to the code of ethics, your values, your beliefs play no role in your job. So whether or not you believe in vaccines, whether or not you believe in abortion, whether or not you believe in whether the sky is blue, that plays no role in the job that you do. So you keep your values, don't ever change your own values, but our own values cannot spill over into someone else's life. That's not acceptable. So let's say we're working with domestic violence relationships, and I think the woman should get out, and I think she should go, do someplace safe. I can't make her, and I don't need to share my feelings with her either. I'm going to support her decision no matter what it is. So if she chooses to stay, I'm going to help put a safety plan into place so she can do that. So client self-determination, client's rights, we're always going to support that. And if you find that your roles, your feelings, your stuff is getting in the way of helping clients, then you probably need to go and do something else. Okay? Because this really is a place where you got to keep your stuff in check. Okay? Promote human and the community well-being. We believe that that we fight for everybody. Okay? So a lot of times I hear talks about those people that are here illegally, right? Those citizens, those people that cross the border. The NASW, the National Code of Social Workers, doesn't take a stand on that. All we do is the people that are here, the people that need our support, we're here. But be careful you're not falling into media and facts, right? So the facts are, if you are not born in this country, you are not entitled to any government assistance. You can't get food stamps, you can't get Medicaid, you can't get unemployment, you can't get any of those things if you're not a legal citizen. So you might, if your children are born here, your children would qualify for food stamps. Okay, so we hear the talk all the time is those illegals are coming over and they're taking all of our services. Not true, not true. And you'll find that most of the time, even if it's the emergency room, the doctor's office, you're not going to find people that are here illegally because they're very much afraid of being caught and sent back. So that is a myth. And as a social worker, be sure that you stop spreading that myth. That is just not true. Do they take jobs? Perhaps they do. But again, let's look at the bigger companies. So a lot of times what you'll see is like the chicken producing companies, they will go across the border and they will pick up people and bring them over to work in this country. You can come over with a work visa. So they'll provide them a work visa and have them come over and work in the country and then not keep up with it. So the company, the Purdue, the bigger chicken people, they should be held responsible for the people they bring over. Same thing with the migrant workers that are picking the strawberries and the tomatoes and all those things. The same kind of thing happens. An American company goes over. They'll hire workers. They'll hire them legally because they give them a work visa to come over. However, they don't always follow up on them. Okay, so we're looking at humane society and community well-being. We're not going to look at the guy who's trying to pay the rent. Let's look at over here at the big company that keeps doing it and gets away with it. So again, so when it comes to our people that are here illegally, they again, it's from the government. The children that are born here would get food stamps. Okay. And for that child, not for the whole family. So mom and dad most often are not getting any government assistance. When it comes to other oppressed people, the African Americans, Latinos, Chinese Americans, Native Americans, people living with disabilities, LGBTQI community, religious groups, anybody that certainly doesn't have power in the community. Our goal is to always fight for the underdog. So people that that society has not allowed them, or there's not been an ability for them to rise above their circumstances, that's who we're fighting for. Let me go back to that. So when it comes to that poverty, let's just clarify, because what we see many times on TV is we see black, brown, poor people always trying to get something from the government. If we look at the government, we realize that in the United States, the majority of people, there's 60% white people. The black population is 14%. Our Hispanic people is less than that. So remember, if we're looking at the majority of people that are getting social services, those are going to be white people that are born in this country. So that's where the majority of our social services go. So look at 14%, so then that's a tiny percent of the 100% of people in America. So social justice is an ideal condition where everybody has the same basic right. That, with COVID hitting, what we saw definitely is a huge divide in the social service and in the socioeconomic status of schools. There were kids who suddenly couldn't afford to go to school. Couldn't go to school, and because mom and dad had to work, maybe they didn't have access to home computers. I've seen stories where they sent home one computer for, there are 5 kids in the family. So that's not fair. The kids who had money, right, could hire a private teacher. They went to a private school where school never stopped. So remembering what we're looking at, of what kind of population we're working with. Okay. So that exercise 2 is right there. Okay. The problem-solving approach, this is the steps that we take, whether it's with a family or with a group. The first thing we're going to do is we're going to identify the problem. Okay, so what is the problem? What are some possible solutions? We're going to evaluate the solutions, implement the solution, and follow up. So remember, when it comes to those possible solutions and who picks, it's the client, not me. This is not my life. So let's look at a typical example, right? So a woman comes to you and she's 25 and she's got 3 kids and she's not sure she wants to have a baby, right? So then evaluate the possible alternatives. So she can keep the baby, she can give the baby up for adoption, she can abort the baby, right? So those are some choices that we can choose. So we're going to evaluate the possible solutions for her. In her life, what are the best choices? And then after she chooses, we're going to look at then how we set these goals. So if she chooses to raise the baby, that means she needs additional financial support. If she chooses to adopt the baby, to give it up for adoption, we need to hook her up with an adoption agency. If she chooses to terminate the pregnancy, then she needs to seek a medical attention. So whatever that solution is, I'm going to provide those sources, right? Then I'm going to make sure I follow up with the client to make sure that things are good with her. The strengths perspective really just talks about that we believe that people have their own inner strengths. So the strengths perspective is to identify, use, and build on the reinforcement, the abilities and strengths that people have. Okay? So we have these inner strengths. There are people that you know that are just not going to give up. So they're going to fight, they're going to fight, they're going to fight. In general, if you find people that have really good, if you find that people that you're not, maybe you don't like, maybe you're like, I don't understand them, if you look at them from the strengths perspective, that changes how you see them. So what we're looking at is, wow, how did they do that? So yes, she may have lost her job, but look, she's managed to feed her kids. Yeah, she's a former drug user, and she relapsed, but look, she's been clean 5 years already. So we're looking at the good part, the inner strength the person has, as opposed to always looking at their deficits. So when you're working with families, sometimes you're going to have to strive to find those inner strengths, because they're not always so easy to find. Every individual, group, family, and community has a strength. The strengths perspective is discerning these resources, finding out what is the strength in that client, in that group, in that community, and really enhancing that and building up on that. So even if we talk about individually, so we talk about individual counseling, so if a client they present with depression, right? And we're looking at, oh my gosh, all these things have happened, but we're gonna look at their strengths perspective. So yes, you've been depressed, and yes, things happen, but you're still here. You managed to raise the kids. You managed to get dinner on the table. All those things happen, but look what you did. So it really changes our cognitions, the way that we think about ourselves. Okay. Trauma, abuse, illness, struggle may be injurious, but there also may be a challenge and an opportunity. Clients who have been victimized are often seen as active and developing individuals who, through their trauma, they learn skills, they develop personal attributes, and assist in coping with future struggles. Okay, we all have crises in our life, right? All of us do. So the goal is that on the other side of the crisis, right, it'll get better. So as I struggle through and I learn my own inner strengths, I'll get through this crisis. And that's the goal that I'm going to take when I'm working with a client, that let me get you through these crises. Many social workers recognize the importance of strengths perspective when working with clients. If you only focus on their shortcomings, their weaknesses, their deficits, and problems, then the clients are apt to lose their self-esteem and self-worth. They see themselves as losers and and give up trying to get better for themselves. Once they give up, it's a self-fulfilling prophecy. Like, I knew I'd never be anything. My mama never said I'd never be anything. She said I'd never finish college, right? It becomes self-fulfilling. And they may end up on a life living on a society for handouts because of the way they view themselves. But if we lose the strengths perspective, if the social workers see clients as equals, okay, and help with them to identify their strengths and resources, right? So the equals is that, so that could be me, right? So that could be me in that chair. That could be me that I'm working with. So you're my equal. I'm not looking down on you, you poor, soul, but I'm your equal, and you've gotten stuck in this crisis, right? So the goal is to make sure we can get you through this crisis. Okay? The old adage of the fish story, remember, we're always teaching people to fish, not teaching people to fish, not how to fish. I'm going to step out just a second, guys, and take this phone call. Right back. Well, maybe not, because I don't know. Okay, so let's continue with our lesson. Another famous example, this is the one of Stevie Wonder. I like this story. Everybody knows Stevie Wonder. He was a songwriter, producer, singer, musician, Hall of Fame. He was born with retinopathy, his eyes, of prematurity, which caused his retina to detach, resulting in blindness. With the support of his parents, he learned to play the piano at 7. At the age of 9, he had mastered drums and harmonica. After his family moved to Detroit in 1954, he joined the church choir and began to develop his singing potential. At the age of 11, he was discovered by Ronnie White and the Miracles, who arranged an audition at Motown. Okay, so all of these things happened, but we can imagine if his parents raised him as your poor little blind boy and you can't do anything. Okay, so those are the stories that we're looking at, knowing if we look at the strengths perspective, no matter what you bring into it, you've got strengths. Okay. Macro, Mazo, we talked about that previously, I think. Micro is working one-to-one. Meso is working with families, and macro is working with organizations. So the knowledge, skills, and values needed for social work practice. So these are the things that the NASW, the Code of Ethics, have decided are the things that we work on. Okay? So demonstrate ethical and professional behavior. So as I said before, we are a profession, right? A client cusses at me, I can't give it back as much as I'd like to. That's not an option. I'm a professional. I'm going to dress professionally. I'm going to speak professionally. So I'm going to say to you that many of you, if you have visible tattoos, that is something that many agencies still consider unprofessional. So you may have to cover them. You may have to wear makeup over them. And you may say, oh my gosh, the people who are working there have tattoos, and they might. However, they've already been established in their field. So that's a lot different than the person that I'm hiring. And remember, you might be interviewing people who are my age. I'm 56. And yes, I do have a couple of tattoos, right? However, many of the older population still see that as unprofessional. I have this conversation with my kids all the time. They're 29, 24, and 17. And how they look and how you want to be and how you want to represent yourself. And that's great and all once you get a job, right? But you're not spending this money, this time learning in school to go and not be able to get a job. And how we look, how we present ourselves still matters. I'll remind you also the importance of your Facebook page. One of the things that we always do when we look at hiring people is we Google you. We look at your Facebook page. So as you're becoming a professional, one of the things that I suggest is either starting a professional page and a personal page, or on your personal page, make sure no one can see anything, right? Because we're going to look. So if you're working with, trying to work with drug addicts in that population, and I see you like hanging out with your friends, and I see a joint on the table in the background, things like that are not things that are going to want to hire you. So, and if it's out there in a digital image, it's out there, and many times we can find it. So I promise you, I own a business, and I know before people sign up to see me, they Google me. They look and they find pictures of me and images of me. So if there are things that you want to keep, then you might just want to put them on really private, or again, establish a separate Facebook page. That's part of being a professional. Social workers understand the value base of profession and its ethical standards. We follow the laws, right? We make ethical decisions. I'd like to tell you that what happens in your personal life doesn't affect your professional life, but that's not true, and especially in a small town. So with the issue of spanking, right? The Code of Ethics, we teach parents that spanking is not okay. It's just not okay. You don't put your hands on another person. That is not acceptable. First of all, if you tell a parent that it's okay to spank, and that parent spanks the child enough to hurt them, then you and your agency are going to be liable. My social worker said I should. Nope. Okay. And let's imagine that you spank your child. Okay. So even again, just a spanking, right? He goes to school, he tells his teacher, my mama spanked me. CPS comes out and investigates. The front page of the news says, social worker beats kid. And even if it's not true, right? By the time it's cleared up, you've lost your reputation in the community. And it's a small community. So you really want to make sure that you have that professional. So that's your technology, things like that. Engage diversity and diverse in practice. So many of us live in a community that people look like us, talk like us, sound like us. And especially in this area, that's the majority of white people. So remember, in this area, you've got to step out of your way to be familiar with other practices, other beliefs. So in the diversity class, I used to make you actually go interview someone of a different category, a different race, and we've changed that just because of COVID. But you know, the people at the nail salon and the Buddha that sits at the nail salon that they feed the Buddha, or the Indian people at the gas station that you see every day, you know, make it a practice to actually get to know them, to ask something about their community. Okay, so we don't want to have these eyes that we just see the world through our eyes, right? Especially when you're living in North Georgia and all we see is this way. That is not how social workers practice. We look at it this way. Okay, and yes, they do something different than I do, but it doesn't make mine better. It just makes it different. And difference is good. Again, social justice, we talked about that. That's fair to everybody. Practice-informed research. So the Code of Ethics says that we're always supposed to be part of research. I don't expect that of you. However, what I do expect is that when you're doing therapy, when you're doing services, you're going to use something that is based in research, right? We're not going to do something because my mom and them said. Oh, so I think I talked before about potty training. So research says, and we've looked at this, not just in your family, but everybody's family, that babies really aren't ready to potty train until they're about 3. Okay? That is a fact. That is a fact. Yes, your kid may have been potty trained at 2, and I'm so proud of you. However, when you're talking to a client, remember, research says by 3. So don't tell them by 2 their baby should be out of diapers, because that's not fact. That's what mom and them said. That's what you heard growing up, and especially in families of poverty, you can't afford to have 2 in diapers, right? That's where that kind of myth comes from. So remember, when you're working with clients, you want to make sure that you have the facts, not just what mom and them said, or grandma and them said, or my cousin, right? Policy practice, again, those are changing the laws. We'll work with individuals, families, and groups. We'll assess them. That means we'll get to know them, keep asking those questions. You intervene. Those are the changes that we'll make, and we'll evaluate after we intervene. Those are the same steps we learned before. Okay? And in group practice, again, we're taking all those things that we learned in individual practice and put them in group practice. Okay? So this is your summary of this session. So 2.6, that's the summary, the chapter review. Okay. The terms you need to know from this chapter. I'm not sure if I went over homeostasis, but homeostasis is your normal. It's your routine. And people always think that homeostasis is a good thing because that's your where your equilibrium lies. Homeostasis is not a good thing always, especially if what happens in the family is dysfunctional. So the homeostasis is your normal. And for many of you, I could probably go to your house and spend a week with you and watch your normal and see what happens, right? Okay, so if we're looking at your normal, then what I'm trying to see is what happens. But if the normal is that you go home, kick the dog, beat the wife, all those good things, that's not good. And part of what social work profession does is we come in and change that homeostasis. We try to change that. But people tend to go back. People like their routine. Let's go back to the chapter here. Okay, so we went over that. Okay, your quiz is, did you get it? Okay, so a generalist social worker can be defined as, don't we think all of those? All of those roles, right? Okay. This one is a change agent. General social worker can be defined as a change agent. What key concepts are included in general systems theory? So in general systems theory, we looked at many different concepts. We looked at the, let's see here, empowerment, wholeness, homeostasis, wholeness, relationship, ecology, wholeness, relationship, and homeostasis. A social worker who believes patient's problems are from within the patient and a diagnosis of schizophrenia is influenced by genetics, that would be that medical model, right? Genetics is the medical model. What does a social worker who uses the ecological model use to assess human behaviors view as a problem? The ecological model looks at their environment, right? Jill goes to see her social worker for assistance in learning how to manage her child's behavioral outbursts. The social worker refers Jill to a parenting class at the local mental health center. This scenario, the social worker acts as a broker and is focused on what? She's brokering for her, right? Okay, she's linking. Okay, so make sure you go back and finish that quiz. Okay. This is my case study on Allie. Okay, so again, it gives you what you're supposed to do. You're going to read about her, and you're going to then go back and check your answers. Okay, and the reflection, of course, that is based on that first, when you first did the first assignment. Okay, so that is chapter 2. Okay, so next week we'll start chapter 3. Okay, your why am I here assignment, of course. Okay, so guys, that should kind of give you a heads up of how the class is going to work. I've said to you, if you've had me before you could not work ahead in this class, you really can. You don't have to wait for the videos. You can definitely, if you have the book, you can work your way through the class. It's just fine with me. So again, with COVID, we don't know what it's going to look like. So we're trying to be more flexible when it comes to the grading. I'm not necessarily the grading, but when things are due. So you'll see that these are open. So you can go ahead and start and work on these whenever you so choose. I will see you next week, and thank you very much for watching this video. I hope you found it helpful. It'll be posted in your chat box. You can go back and you can watch it as many times as you'd like. It's been a pleasure, guys. Dr. Pam, out.